Hi guys! Tin Spence here again. I never knew that there was such a thing as hidden blood loss before. It's very common in hip surgeries, especially dynamic hip screw and femoral intramedullary nailing surgeries. Apparently, there could be between 400 ml to 1.6 liters of hidden blood loss for these surgeries. A hidden blood loss is a blood loss that is not seen physically during surgery. Even if you measure all the swabs, everything that's in the suction, all the blood loss that is physically there while you're operating does not amount to the amount of blood loss that the patient will actually have for that particular procedure. The reason why I came across this information is because I have been doing a lot of hip surgeries for the past few years. Dynamic hip screw, intramedullary nailing. And every time I've been looking at it and I was thinking, there's not that much blood loss. I can see it with my eyes. I'm observing it. And the anesthetist always insists that there's a lot of blood loss. A lot more than what I actually see. And so that made me really curious. I actually started to measure it. So I started to measure what's in the suction. I started to measure what's in the swabs because I'm like, I don't see that much blood loss. And they keep insisting that there's that much blood loss. And so I looked at it online and I discovered that there's actually a study about it. I will include the link down below for you to check it out yourself if you're interested to see this study. So they actually did a study about hip surgeries. And when I was reading it, I was like, oh my gosh, that makes so much sense. That's why, because of the hidden blood loss. The study is saying that maybe is presumably this hidden blood loss is from the trauma itself up to the time they have started to do the surgery. Apparently, it doesn't always necessarily show in your blood test yet. While they are recovering, there's more blood loss. Apparently, some can also have some gastric bleeding. The conclusion that I got from that is to have better practice in the future. The way to estimate blood loss for these cases would be apparently the total blood loss, including the hidden blood loss, would be better estimated by getting the physical blood loss that you get, which is the blood loss from the suction, the blood loss from all the swabs. Multiply that by 6. That would most likely be your actual blood loss, including the hidden blood loss. I think that's pretty interesting. Who knew? I didn't know.